The humanitarian crisis in Gaza deepens daily, marked by severe shortages of food, water, and essential medical supplies. The ongoing blockade restricts access to crucial resources, exacerbating already dire living conditions. Hospitals struggle to cope with the influx of patients, lacking basic equipment and medications. The healthcare system is overwhelmed, leaving countless individuals without access to necessary care. Trauma cases surge alongside chronic illnesses neglected for lack of resources. Electricity outages are frequent and prolonged, disrupting essential services like water purification and healthcare. This lack of power impacts all aspects of life, including sanitation and food preservation. Residents endure sweltering heat without reliable cooling. Unemployment rates remain astronomically high, leaving a significant portion of the population impoverished and desperate. This economic hardship fuels social unrest and further strains already limited resources. Families struggle to provide basic necessities. The blockade severely limits movement of people and goods, hindering economic activity and humanitarian aid delivery. Gaza's fishing industry is heavily restricted, impacting a vital source of income for many. The agricultural sector also suffers greatly. Schools are overcrowded and lack essential learning materials, jeopardizing the education of future generations. Children face immense psychological distress resulting from violence and displacement. Educational opportunities are severely constrained. Mental health challenges are widespread, stemming from years of conflict, poverty, and political instability. Access to mental health services remains severely limited, with many unable to seek help. The collective trauma is immense. Water scarcity is a major issue, with unsafe water sources contributing to disease outbreaks. The wastewater system is inadequate, posing serious public health risks. Contamination of water supplies is a constant concern. Sanitation infrastructure is inadequate, leading to the spread of infectious diseases. Overcrowding in shelters and homes exacerbates the problem. Waste disposal mechanisms are insufficient. The reconstruction of homes and infrastructure damaged during previous conflicts remains incomplete. The lack of building materials and funding slows progress. Recovery from past destruction is stalled. Food insecurity is pervasive, with many families relying on food aid to survive. Malnutrition, particularly among children, is a serious concern. Dietary needs are often unmet. The limited access to clean drinking water leads to an increased risk of waterborne diseases. Children are disproportionately affected by these preventable illnesses. Public health initiatives are hampered. The psychological trauma inflicted by recurrent conflict and violence affects individuals of all ages. The lack of adequate mental health care worsens the situation. Healing and recovery are slow processes. The fishing community faces persistent limitations imposed by the ongoing blockade. Their livelihoods are severely threatened, leading to economic hardship. Access to fishing grounds is restricted. The agricultural sector suffers from limited access to seeds, fertilizers, and export markets. The blockade directly impedes the production and sale of agricultural goods. Farmers' incomes decrease drastically. The blockade restricts the importation of essential medical equipment and supplies, hindering healthcare services. Hospitals are under-equipped and understaffed, affecting patient care. Medical needs remain unmet. The population faces significant restrictions on movement, impacting access to education, healthcare, and employment. The blockade's impact on daily life is immense. Freedom of movement is severely curtailed. The high unemployment rate contributes to poverty and social instability, fueling tensions within the community. The lack of economic opportunity creates a sense of despair. Social cohesion is tested. The ongoing conflict and blockade have created a sense of despair and hopelessness among many residents. The future seems uncertain, with limited prospects for improvement. The psychological toll is significant. Access to international aid is often limited due to the complex political situation. Delivering assistance remains challenging, particularly in reaching vulnerable populations. Bureaucratic hurdles persist. The infrastructure is dilapidated, with limited capacity to handle the needs of the growing population. Repair and improvement efforts are hindered by funding limitations and the blockade. Infrastructure is crumbling. The lack of access to adequate education diminishes future opportunities for young Gazans. Their prospects are limited by the prevailing circumstances. Hope for the future wanes. The prolonged conflict has had a devastating impact on the environment, including the depletion of natural resources. Environmental degradation exacerbates existing challenges. Sustainable development is threatened. The lack of fuel and electricity impacts all aspects of daily life, including cooking, heating, and communication. Basic necessities are affected by power shortages. Daily life is immensely impacted. Families struggle to make ends meet, leading to increased levels of poverty and vulnerability. Basic needs are often unmet, resulting in hardship and suffering. Families fight to survive.